Deputy Director of Health Services, CMD, AFST, and we also have the Deputy Executive Director of LCA, and then Registrar of the Pharmacy Council, Mr. Morgay. Colleagues from the media, we want to welcome all of you to this important press briefing in which the Honorable Minister will give an update in relation to AKI, and we also have a question and answer session. And as usual, when the Minister made a statement, we also follow it with question and answer session. And I want that, as usual, how we have been doing it, we make it so organized that at least everybody will understand why we are here. So we listen to each other, we take our time, and we ask the questions that we are asking, and for sure you get the right response, but the people who matter are all here. So you get the right, and all the questions doesn't mean that we'll be directed to the Minister, but when you just raise your question, and then where it will be answered, it will be answered to your satisfaction. On that note, I now invite the Honorable Minister of Health, Honorable Amin Lamin Samate, to give his statement, but also we'll do it in such a way that the first part will be English language, because we want the general understanding of the entire population, so it will also be in local languages after the English summary. Thank you.
Thank you very much, Mr. Chair. Good evening, colleagues. Good evening, ladies and gentlemen of the media. We are gathered here today, this evening, to have a press briefing with regards to the acute kidney injury cases in the country that we've been seeing in the recent past, even though we are still seeing them. And equally speaking, to have interactions with the media so that the people of this country, our beloved country, know what is happening. But we first of all start by extending our deepest condolences to the families who lost their loved ones to acute kidney injury in the Gambia in the past almost 3 months. It has been a very difficult period for the families. It has been a very difficult period for the whole country. It has been a very difficult period for the health workers. It has been a very difficult period for His Excellency, the President, and his entire government. This is a phenomenon we had never seen in this country before. And it has stretched us very far and stretched us to the limit. To the families, we say, we share your sorrow, we share your sadness, we share your sleepless nights. And may the Almighty Allah grant the loved ones that have passed away at Jannatul Firdaus, and may Allah give you the fortitude to bear the loss. I must say, this includes my own family. I lost a nephew to acute kidney injury on Wednesday. This shows that no one is exempt when there are health disasters, when there are health emergencies. As long as we are all human beings, health emergencies concern us all. At this juncture, I would like to mention here, we thank His Excellency, the President of the Republic, Mr. Adama Barrow, for coming out yesterday to engage the people of his country in the presidential statement, which goes to extend condolences to the families, which equally indicated the situation of acute kidney injury in the Gambia, equally what had transpired with regards to the occurrences of the cases, what had also transpired with regards to the care and attention the patients had received, what had also transpired with regards to the investigations until we were able to have a direction as to the possible cause of acute kidney injury, the acute kidney injury in the children, and what his government had done, is doing, and will be doing. However, at this juncture, the statement by His Excellency, the President, with regards to the statistics, was by no means intended to be insensitive. He was actually portraying the disease trend, explaining to the people of this country a new phenomenon that we had not seen, but it was by no means meant to be insensitive. And we have realized that some people took offense in that paragraph, and we wish to sincerely apologize for that paragraph. And as his advisors, we take full responsibility of that statement. The intention was to explain to the people of the country the disease pattern, but not to be insensitive to the loss of lives in the country. As he emphasized, loss of a single life is one too many. It is never the wish of any leader, whether it's a leader of a compound, a leader of a town or a village, or a leader of a nation, to lose a single life in his country, compound, or household. And as a parent, His Excellency the President feels your pain. He feels the loss of loved ones. He has had a personal experience of that in the past, a number of years ago, and he knows how it feels to lose a son or daughter at a tender age. The welfare of this country, the welfare of the citizenry of this country, is His Excellency's topmost priority, and he will continue to endeavor to ensure that the people of this country receive the best. And the provision of the healthcare services of this country, ensuring that the people get the best of care, has been very high on his agenda. The hospital, before and even during this AKI outbreak, has received a lot of support as the physicians, the doctors, and the nurses, and all the support staff tried to support these children who were sick, His Excellency's government was at the forefront providing support, providing medical equipment. Items were brought in very, very urgently within short notices to ensure these patients get the best of care. Within the last 2 months, 9 hemodialysis machines have been bought. 2 of them are specifically for children. We've never had specific hemodialysis machines for children, and we can say a lot has been done, and we thank His Excellency for the support. We thank the doctors at the Edward Francis Small Teaching Hospital, the nurses, the laboratory scientists, the pharmacists, all the caregivers at the Edward Francis Small Teaching Hospital who participated in the treatment of these patients. Acute kidney injury, as we are aware, is a very devastating illness, even in adults, talk less of in children. We had elaborated on the possible causes. As we mentioned earlier, initially, the thought was that it's a bacterial infection that was causing it, in addition to the diarrhea and vomiting that this patient presented with. But as we looked at the trend, we realized that many of these children had also been given drugs. And a pattern became clearer. And with the experience of the experts we have at Edward Francis Small Teaching Hospital, that enhanced our clinical acumen to pick these cases at the point they were picked. We had to do quite a lot at the hospital, but a lot could also not be done in the country because this is a developing country. We do not have all the resources. But I must tell you that government is doing all what we can do to ensure that this country gets all the resources that are required to deal with such cases. It has not been easy, but I wish to extend His Excellency's unflinching commitment to ensure that the health facilities of this country are the best in the region. To further expand his commitment, to the health facilities of this country, he ensures that his family obtains health services from the Edward Francis Small Teaching Hospital. His own daughter was admitted there, and the First Lady was with the daughter there for a number of days, just like any other mother and a child. His mother also was admitted there and received treatment from that place. That shows that he doesn't belittle our system, but he shows his commitment to the system, and he says, whatever is good for the people of the country is good for his family. Whatever is bad for the people of the country is also bad for his family. So just to emphasize the commitment. To the bereaved families, His Excellency has put up a high-powered delegation who will be meeting with them who will pay a condolence visit and update them on the steps government is taking. We want to tell you equally that as we speak, drugs that have been found to be contaminated so that they are engaged in the usual way when such things happen. We also want to inform you that the police has already started work. The officials of the Medicines Control Agency and the importers of these drugs have already been invited to the police headquarters to help the police in further investigations. The license of the importer of the drugs, under the instruction of His Excellency, has been suspended as we speak to you. We have seen that the outbreak of acute kidney injury is contained now. We are no longer seeing many cases, and that is a good sign of containment. The total number of patients who had acute kidney injury as we speak is 81. And on receiving the mortality figures from Senegal as well, where some of the patients were taken to, we now have a total mortality of 69. Distinguished ladies and gentlemen, this is a very difficult time for the entire country. This is a very difficult time, a time that needs us to work together as a nation, a time that needs us to support the health workers, continue the investigations, because the investigations of these causes of death or the cause of death of these children is not concluded yet, because there are a lot of other things that need to be done to know exactly the cause of death, the cause of acute kidney injury, and the cause of death of these children, even though we highly suspect the contaminated medicinal products. Our epidemiologists and other health workers are working with teams from the WHO, World Health Organization, and the Center for Disease Control in America. And amongst them, we have anthropologists and epidemiologists who have vast experience in issues of such nature. And these individuals are all working with our teams to ensure that the investigations yield results that government can act on decisively. We assure you that government will do whatever is possible, inshallah, to get to the root of this, and decisive actions will be taken based on the findings. In a related development, the World Bank has pledged to help the Gambia put up a drug quality laboratory, a food and drug quality laboratory, so that we do not see these kinds of problems again in the future in this country. Some of the challenges we face as a developing country, because of the poor resources, the Gambia has similar challenges to other developing countries. Many of us do not have quality laboratories to test these drugs on a regular basis. This is a challenge even in some of our bigger neighbors, where some of the samples were sent and they couldn't do it all until we all had to send some samples to other countries. And even with that, there are certain tests that actually take time, because if the contaminant is known or there is a suspected contaminant, it is easier to check if that actually is contained in the sample that you have sent. But if the contaminant is not known at all, they have to test it and match it along with so many other possible toxic contaminants, potential contaminants, and that takes time even in the very advanced countries. The other tests are still also being continued. That is, the isolates, the bacterial isolates from these individuals are also still being tested. Sequencing is being done so that at the end of the day, we can put all these together to get to know the root cause of the acute kidney injury in these children. Once again, I want to appeal to the country, the Gambia, the country that we all share, the country that we are all related, in which we are all related to each other, the country which is the only one we have, the country that we need to build together, the country that we need to develop together. We appeal to each and every one of us to see country first. We work together so that we identify the challenges and we build our nation together. This is a time of sadness. It is a time we should support each other as a country. It is a time we should look for the problems, because we as a country are a victim of this problem. These contaminated drugs were not manufactured here. Nobody ever knew or thought that anyone will think of bringing in contaminated drugs that have the potential of causing harm to individuals, talk less of loss of life. So as a country, we are all victims in this. No government, no president, no minister, no director, no mother, no father, no brother, nobody ever wants this to happen in his country. So that means this is a time when the country should come together and we see what can we do to avert such problems in the future. What can we do to strengthen our systems? We talk to the partners. Partners have started listening to us. We had been talking before, but we didn't have the resources to have a quality lab here. In fact, we had taken steps to ensure that all medicines in this country are registered. All the importers had been given deadlines. But of course, that had to go with robust quality assurance systems, where we had gaps because we are a low-income country with very little resources. Once again, we wish to say to the families, government is aware of your pain. His Excellency, the President, is aware of your pain, and we all stand by you. Inshallah, we'll get to the root cause of this. Inshallah, it will never happen again in this country. We thank you very much for your kind attention.
Excellent statement, Honorable Minister. Thank you very much. We have listened to the statement of the Honorable Minister, and now we go into the next phase, which is the question and answer session. Now you will tell me, if you want to ask anything, you just raise up your hand, tell me who you are and which media house you come from. Then from there, then we can ask you a question. And I'll take that 5 at a time. 5 at a time. Yes, you are. Sorry, network. Okay, and who else? Landing.
Yes.
Okay.
Freelance.
Freelance.
Yeah.
But attached to which newspaper?
Starting.
Start. Who else again? You want to ask the person? So you are part of the family. Okay, then you don't need to ask. So you can give suggestions and recommendations. Maybe perhaps you can tell us what you are doing at the FSPH. I'll give you that chance. Who else again want to ask? That's all. Good. So, Fatou Network, you're allowed to give one main question. So you know time is late, and then we want to wrap up as quickly as possible. If that's okay. Please kindly ask your question.
Well, thank you very much, Dr. Samake, for delivering that statement. And my question is, contrary to the WHO report, your ministry issued a press release indicating that 28 children died out of the acute kidney injury. And then Gambians were never alerted about this until the WHO reports are about 66, which actually solved the nation. And tell us what happened. Your ministry, for them not to detect these 66 until WHO, and what organization was involved?
Okay.
Let's go to the next one. You have Landing.
Yes. Landing Sise, Kerr. My question is, the President authorized for the suspension of the lancing import, the owner of the lancing who imported the medicine in the country. We want to know who, under whose lancing these medicines are imported in the country.
Under whose lancing?
Under whose lancing?
Thank you.
And then my second question is...
Landing, no. You have taken the rules one at a time.
Seriously?
No, you have taken the rules one at a time. Okay? Then we have starting.
Good evening, Honorable Minister. In 2020, you faced the National Assembly discussion about the ghost account, which was not addressed well. Earlier this year, we had the sniper cases too, which is still under the Ministerial of Health. Today, we are discussing about 66 children died of avoidable death. is your ministry or is your administration prepared to elevate, improve, and also restore the health of Gambians?
Okay. Thank you. And I will respond to that of the foreign network with regards to the 28.
Yeah. Thank you very much for the question. I think it is important to first and foremost mention to you that the figure the WHO quoted was our figure. It's from here. It's not from them. The way WHO works, in the country, we have a WHO office, which is headed by we call him WR, that's the WHO resident representative, who is part and parcel of our incident management team meetings. He has been with us, and this data is presented to that meeting in Kotu on a regular basis. There is a presentation of the admissions, the mortality, and whatever is being done for these patients. And a line list is developed, which will tell you the patient, the age, the address, the sex, and then what was taken, the parameters for comparison. And these figures, as they went up, they were actually no secret. They were presented to that meeting, and on a regular basis, the WHO resident representative sent those reports to his bosses in Afro, that's the WHO Regional Office for Africa, in Brazzaville, and to Geneva. We were all working on this together. They sent in experts on our request. Because when countries have such emergencies, that's the work of WHO, that's the mandate, international health. Initially, an expert was sent in called the RED, R-E-D, that's the Regional Emergency Director who is based in Afro, that's the Regional Office for Africa, was sent in. He spent a few days with us here. That was followed by the director responsible for pharmaceuticals and medical supplies of WHO. So we worked with them. So the information WHO came out with was our information. They supported us to do the laboratory tests because of their mandate and their networks. They know which labs can do what tests in the whole world. That's part of their mandate. And they also support countries by conveying the lab samples to these required laboratories. And WHO did that for us in the whole of this process. Some samples were sent to Senegal, then to Ghana, all coordinated by WHO, and then to Geneva, Switzerland, and also to France. Now, when we got the preliminary results, as you are aware, we acted here. We said there should be household recall because the preliminary results for those drugs did indicate that there were contaminants. And we say, even if it is not confirmed, we are going to withdraw them from the households. But we had suspended them, the drugs. We did, so when there are challenges like this, there are international best practices. What you do, then what you do next, then what you do next. These are all best practices that have been outlined by international systems. So when that happened, initially, you remember, we said suspension of paracetamol, promethazine. Thereafter, there was quarantining of the drugs. Thereafter, there was withdrawal. And then there, the household withdrawal, and so on and so forth. As we waited, even with the preliminary results, we said we needed to withdraw them. because there was some indication, but it was not confirmed because the lab needed to be sure, because these are very, very serious things. Excuse me. Now, as we awaited the confirmatory results, the WHO went ahead to announce. And I must tell you, the WHO Regional Director for Africa and his team, her team, and the WHO country representative extended the message to me apologizing because that was not the protocol, the correct protocol. The correct protocol was for us to get the laboratory result as a country and we come up with an announcement. That is the correct protocol. The WHO team in Gambia and Brazzaville extended their apology because the protocol was for the country to have been notified of the results so that we take immediate action by informing our own citizenry. Then we, WHO, can take that, then we notify the WHO that this is what we have in Gambia, and WHO notifies the world. So the WHO Director General, I'm afraid, did not follow the protocol, and his team themselves thought that was not correct, and they called me to apologize. This is the pattern. Thank you.
Thank you very much. Now we go to this suspension from landing, the suspension of the launching. What next? I hope the importer will investigate information around the suspension of the launching of the importer. On the whose launching, yeah.
Thank you very much. The license that was suspended was under the instruction of His Excellency, and the Medicines Control Agency has the mandate, and the document, I'm sure you will see it somewhere, the suspended license. The Pharmacy Council, Medicines Control Agency people are here. That's why we brought them. Our apologies, we did not introduce the members of the panel, but introduce yourself so that when we pass the questions, you will know who is answering your question. Yeah.
Yes, I am the Registrar of the Pharmacy Council.
Yeah.
I'm the Deputy Executive Director of Medicines Control Agency.
Yeah.
Right, sir? Fatou.
Babande Savali, Director of National Pharmaceutical Services.
Oh, yeah. My name is Morinja, Director of Health Promotion. Initially, I did the introduction.
Oh.
Okay.
So, and then I introduced
Yes.
them.
Okay, you did. Okay.
So, able to get their names if you want to ask.
Dr. Ahmad Jafari, Chief Medical Director at Edward Francis Moses Hospital. I'm Dr. Mungu Senior Chief Deputy Director of Health Services.
I'm Mr. Fadite, Director of Health Services.
We also have Deputy Director of Health Promotion is also there.
I'm Sanjay Kau, Deputy Director.
So I think Madam Fatou can answer your question. She is there in charge. They suspended that.
The license holder is State Cadet. Yes.
We are doing procedures in the country that were never been done here before, including laparoscopic surgery. We are doing endoscopic procedures here now, which all used to be done in Senegal. We used to send patients to Senegal. We are doing postgraduate training. Medical doctors are now specializing in surgery, obstetrics and gynecology, internal medicine, pediatrics and family medicine right here in Edward Francis Small Teaching Hospital. We have started a dental school. Now we are training dentists. We are training midwives to bachelor's level now. We are training nurse anesthetists to bachelor's level. We will soon start, with the help of World Bank, a school of pharmacy. We have expanded the community health nurses school in Mansakonko. You've seen the new structures. We have expanded, built new structures for the state enrolled nurses school in Bansang. We are currently building 6 new health centers across the length and breadth of this country. We have brought in 90 ambulances in the last 2 years. 80 of them are the community ambulances that have changed the lives of the people who live off the main roads to get them to health facilities for easy delivery. Maternal mortality is going down in this country. The trend of it going down is so rapid. We are currently building 8 COVID-19 treatment centers across the length and breadth of this country. We are renovating 50 health facilities in this country. We have built 5 health posts in Busumbala, Brikama Welingara, Tampoto, Makumbaya, and Brikama Nyambai. And we are about to build another 13 of such facilities. So we can go on and on and on. And how come we are able to do all this? It is because of accountability and transparency. So partners value us and they are coming forward to give us the resources to be able to do this, because they have seen our commitment, our love for country, our honesty, because that is very crucial. And as we speak to you, when these kidney injury issues came, the World Bank came forward. They started, in fact, the advertisement is now on for assessment to design a new drug and food testing laboratory for this country. That is currently going on as I speak to you. Within these 2-3 days we have done that. So I think a lot has happened. And this trend, inshallah, will continue for the people of this country.
Thank you. I think I want to make, yes, I want to go to new ones now.
So why don't we allow him to...
Yes.
We can come back.
That's fine. Yes, go ahead. It's important, yes, go on. Yes. Okay, why come and sit here? Come, bring your seat. No, bring your seat and then you can, in fact, we can have another seat here. Whoever is supposed to come and answer can, yeah. Sniper? What has he been able to do for the health sector? Even people who do not like me, they know I have done very, very well for this sector. They know it. The mindset of the sector with regards to accountability has changed. There are things that people no longer think of in the Ministry of Health because they say that man is there, he's troublesome. Even that mindset alone is good. Yesterday, I was going to JRTS to be part of a panel discussion. A gentleman called me. He said, "Is it Dr. Samate?" I said, "Yes." He said to me, "I never supported you." I said, "Well, thank you." So he said, "But today I'm calling you to thank you." I said, "What is the issue?" He said, "For your stance with your team to first of all work very hard to identify a problem in our country, to identify that there is a problem in children, to work together to isolate bacteria, to work together to see a pattern in the death or in the arrival of this patient to hospital, in the death of these children, to suspect drugs, to suspend these drugs, to withdraw these drugs, to test the drugs, and to come up with initial evidence." He said that is a big step for our country, because all these things could have been missed and all these things could have been worse. The situation could have been worsened. This trend could have continued if not for the hard work of our team. And quite a lot of people, contrary to what some people say, quite a lot of people think with our limited resources, with our limited material and human resources, with our limited capacity as a country, we did very well to detect this and to come out transparently to the public, to say to them we have a problem in our country, to say to them we have seen the trend, it is not usual, and to be able to suspend the drugs and to be able to contain the outbreak. Believe me, I'm not saying it because I'm health minister. You can ask anyone independently. I think the team did our best. Thank you.
Thank you very much. We've now come to the end of this session.
Mr. Chair,
And we can discuss it further.
No, Mr. Chair,
People
you
are
call us for a
some
press
people are
conference,
traveling, some people are
and then you want
traveling.
to glare something.
No, some people
So
are
I don't think you should
traveling.
limit. No, we all know that they are coming from far.
Wait.
Wait, landing.
Can I
You ask two questions. I think you should.
Yes.
Others are asking one question.
I'm
Let
not
them also
satisfied.
have- No, wait. You will be satisfied. You will be satisfied, Landon. Please.
Yes.
You are the same people who will complain that we keep you here for long. I've been getting complaints from, especially you.
No,
Yes,
that,
yes.
that is when you say
So
that.
let's agree now. Let's agree now. We'll just go to the final. Let me also give him chance and give our chance, and then we are done. The other one we can further discuss them later. Thank you.
We might not have this kind of
Wait,
chance,
Landing.
so we have to express.
Landing, please. Landing, when I say please, I mean please.
That is cool.
Thank you, Madam.
Okay.
No, wait, Madam Coley first, and then you come.
Okay. I have a follow-up question with regards to what Mrs. just said in terms of, do you guys normally often go to these pharmacies in terms of checking some of these drugs, whether they, and then having the equipment needed in terms of checking out whether they are false, they are real or not? Because at times, most of the people nowadays will be complaining of, I went and bought medicines to this place this month. So how often do the medicine control agency go out in terms of seeing some of these drugs?
Thank you, Madam, for the question.
You have the same question on the way to the back? Okay. How about you? The same? Okay, then if that's different, then just wait until
Thank you, Madam, for the question. I want to tell you that we have a unit at the Medicines Control Agency known as the Inspectorate Unit, where we have inspectors. That's the central level inspectors. We have not got inspectors yet in the regions, but our inspectors go out quarterly to these regions. We also have the Pharmacy Council inspectors in the regions. We work together. We go out to do routine inspection. From time to time, we go to these pharmacies, we go to the drugstores, and any other outlet to inspect these drugs. We go to do physical post-marketing surveillance. We go for physical inspection and visual inspection. If there is a product defect, we pick it from the field, take it to our store. We do investigative inspection. If we have a tip-off, we move out to go and investigate, follow it up until we close the case. Day before yesterday, we were in Kasai, Phony. We got a tip-off information about the farmers. Our inspectors were there to close it. You understand? We have an inspectorate unit, and we go out to do the work.
Thank you very much.
Okay. Start.
Yeah, I have a suggestion and a question. If you would allow me to go with the two, or I go with the question only.
Can you take one because it's late?
The suggestion could
The third one.
the suggestion could be helpful to the country.
Yeah, just then give us a suggestion.
But a question also is very
No, that cannot.
Allow him.
I beg your indulgence.
Allow him.
Okay, no problem. It's the same people who will complain about time.
You will be very good. Yeah, I came
Okay.
from Brooklyn.
No, it's okay. Then go ahead.
Okay, the suggestion is, can the government be a central supplier to all of these drugs, where the government will inspect these drugs, and then there will be nothing like having a second party that will be doing this to avoid the case of Kebe, as mentioned here. If the government is a central receiver of these drugs from any company, we would avoid having poisonous drugs in our system, thereby calling on the AKI, which is the order of the day today, or any other condition that could be as a result of poisonous from the drugs. The question there would be, we have seen in neonatal mortality, and also infant mortality getting rise from the president's past, which what he says, 60% not variance to what has been happening. This could have indicated that there are lots of infant mortality or neonatal mortality. Will you accept this? And secondly, are you ready to say you are sorry that this came as a result of avoidable error? If enough materials were in place, this poisonous drugs would not be circulating in the community. So I would be taking this as is an error from the health department, and also is the government prepared to have a quality laboratory where to test these drugs? Because I've not been seeing any quality laboratory in the country here. The Gambia is in her 50s going to 60. Still, we don't have independent or standard laboratory where we could do this test, depending on other countries.
Thank you very much.
Yeah, I can take that. Yeah, thank you very much. I think your suggestion is well noted. The entire drug procurement system is going to be reviewed. With the coming into health, with the coming into being of the health insurance system scheme in the Gambia, the way drugs are even brought to even public hospitals is going to be centralized, and is going to, well, it's centralized now, but there's going to be an improvement whereby they are going to, we're going to form, just like it happens in Rwanda. We have already started that process. The other process you mentioned is happening in one or two neighboring countries, and that is what we plan to do. You know, I think the truth of the matter is nation building is not easy. You didn't meet all this in place, and you do them as time goes on. Not everything is doable in one day. We didn't meet all this in place as a government, but we want to do them. You spoke about we are grossly saddened by the loss of lives. These are our own family members. We are all family members. And as health professionals, as people entrusted with the provision of health services to our country, we are devastated, I must tell you. It has been one of the most difficult periods for any of us. Very little sleep, under a lot of stress every day. We get saddened. And this also includes the president himself. Each time he is giving a briefing on this issue, you could see he feels really, really sad. But there are challenges of availability of resources. We wish the Gambia had all this before now, but the resources are not enough. To get a good quality lab that can do most of these tests costs millions of dollars. We didn't meet them. It's not available. We had planned, we had talked to partners, but the resources are not forthcoming. But now, you know, after a sad incident, of course, very sad, partners have shown indications to support. So as I mentioned to you, World Bank is already advertising for people to send in letters of interest for the design of quality food and drug lab for this country. Because we think it has happened with drugs today, we need to think about the foods as well. We shouldn't just do for the drugs. Sorry? Yeah.
The food was tested on sniper.
So you see, so now, you know, so we said we need to have a comprehensive food and drug laboratory for our country. So we're doing that. Now, when you also asked about what government is doing, it escaped my mind to say that we did mention to you the Fatou Hospital is going to be the modern teaching hospital of 1,500 beds. The president announced it.